Welcome back, students. Let's get into Module 5. Module 5 is the emotional and physical changes in older adults. The Center for Disease Control classifies these 6 items as disabilities. Number 1 is a mobility disability, and that is someone that might have difficulty getting around from place to place. Maybe they have difficulty walking or climbing stairs. There can be a cognition disability, and that is someone who has difficulty concentrating, remembering, or making decisions. There's hearing disabilities and vision disabilities. There's disabilities that create problems for people to live independently on their own. And then self-care disabilities, when people cannot take care of their own self-care needs, their grooming, their hygiene, their eating. Disabilities that affect mobility, that's kind of where we're going to focus for a little bit, because a lot of times that's why they need that extra help. So here's some disabilities, some common ones that affect mobility. You have multiple sclerosis or MS, Parkinson's disease, which is a big one, and actually the fastest growing neurological condition right now. You have ALS, which is also called Lou Gehrig's disease, and then a host of other diagnoses or disabilities. And what happens is this person who has one of these disabilities may need help getting around. They might use a walker or a cane. They might be at a high risk of a fall because of the way that they walk. So we're going to look at specifically Parkinson's disease, since it is the fastest growing neurological condition. Parkinson's disease will sometimes give people movement that they don't want, that they can't control, such as a Parkinson's tremor. So what happens in a Parkinson's tremor is they have this tremor in their hand. It's movement that they can't stop. They can also have what's called an athetoid movement, where their head and their body kind of writhes around. They can't control that or stop that. They can get what's called a mask face, where the facial muscles show no emotion or inappropriate emotion. They can't control it. Then on the other side of that coin, someone with Parkinson's may be told to stand up, and they cannot get their brain to tell their body to stand up. Just won't go. Parkinson's has another component of that commonly, which is called Lewy body dementia. So Parkinson's can be a movement disorder, both of movement that you have and don't want, and movement that you want but can't get, and also a dementia component. It's very complex. This video is the story of Allison. She is a 50-year-old woman who is diagnosed with Parkinson's. I want you to pay attention. She has the athetoid motion in her head. She has the mask face. She talks about what it feels like to have this type of disability.
When I went to the neurologist for the first time, I went there for, I didn't think I'd get a diagnosis. I didn't think of any tests or anything. And he ran these simple tests, and he just turned to me and said, "You have Parkinson's." And I was by myself, and I was totally devastated. So I immediately called my partner, Phil. And then I left the doctor, and the first thing I did was I went for a run. I was embarrassed about it, because as far as I was concerned, it was an old man's disease. And here was I, this fit 50-year-old, struck with this old man's disease. And initially I was very angry. Very angry. It took away my life. But I have to make a new one. Every time I tell the story, it's hard. Because you think of the life you had before, and you're just never going to be the same again. Only my brother knows. I haven't told my parents. I haven't told them, and I won't tell them, because it's too much for them to know. They don't need to know. So since I was diagnosed, I've taken up boxing and Pilates. So there's the two methods of connecting with my body. It's difficult to describe. I mean, just imagine not being able to walk. You try and send a signal to your legs, and they don't respond. They literally don't respond. I mean, I'm a control freak. I don't doubt that. So Parkinson's tries to take away that control, and I can't let that go. So I need to keep that going. Looking ahead is very scary. So I keep trying to not look ahead. I keep trying to do stuff that will keep me balanced and keep me going and keep me on this plateau I am right now. Because I don't want to think about the future.
So it's a very scary place to be, not wanting to think about the future. And then just feel for a moment, imagine what it would feel like not to be able to get yourself around when you wanted to, not to be able to get yourself to the bathroom. That would make us feel isolated, maybe angry, depressed, frustrated, withdrawn. So when you can't move yourself around, there's a whole lot that happens emotionally. Now, side effects, if I'm not moving around, if I'm not getting up, and if I'm not able to walk, and I don't have anybody helping me, I don't have anybody reminding me to get up, what starts to happen is we get this vicious cycle of side effects from decreased mobility. Okay. The first thing that happens is the muscles start to shrink because we're not using them. And when the muscles shrink, we lose that muscle tone, we lose that muscle strength, and we lose endurance. So then just going and taking a shower is exhausting. When we don't get up, our joints stiffen, so then it becomes painful when we do get up. Another thing that can happen is our bones become brittle because we're not weight bearing through them. And so it becomes more likely that when we do stand up, it would be easier for us to fall and fracture a hip. Sitting all day or not moving around increases our risk for blood clots and urinary tract infections, for pneumonia, swelling in the legs and feet. These things combined increase our risk of needing to go to the hospital. And then everything on this list decreases our chances of being able to live independently at home. So I know you guys have all heard, if you don't move it, if you don't use it, you're going to lose it. And with muscle strength, with tone, it's really important to keep that mobility up. If we can't get ourselves to the bathroom, if we can't get ourselves around, there's a bunch of other things that happen. We also want to consider other emotional things that might be going on in an older person's life. The person that we're caring for, maybe they were the CEO of a big company and now they're retired, maybe because of age or disability, and now everybody's telling them what to do. They've lost their social status. And then maybe they were married and now they're widowed. Grief and loss in this age population is very common. And we don't really understand that. I think we just kind of gloss over that. It's important for us to acknowledge that grief. I had a patient a couple weeks ago that lost two of her dear friends in a week. And she said, just wait till you get to this age. My friends are dropping like flies. We need to acknowledge that pain and that loss and that grief and allow them to feel it. Maybe because of a mobility issue, arthritis or a stroke, person we're caring for might have lost their ability to participate in their recreational activities. And maybe those were the things that, brought them joy. So they don't have that now. Diminished hearing and diminished vision can decrease the way that we interact with people. And so it changes our relationships. There's a loss of meaningful relationships, and then ultimately this feeling of isolation. As a home health physical therapist, especially working with the older population during COVID, that isolation was so evident, and its effects on people's desire to even live. There's a video, if you choose to watch it on your own time, it is of the introduction to the movie Up. It's just 4 or 5 minutes, but what it shows is, like, in the blink of an eye, it shows a lifetime and the changes that occur throughout a lifetime. As caregivers, we need to remember that when we show up, that the people that we're caring for have lived a whole life before us. So if we arrive and they're grumpy or they're grouchy or they're sad, we need to sit with them and really find out why. And then understand that there's a reason.